रेडियोलॉजी लेंगे तो पैसा ही पैसा होगा. Well, if you are someone who is thinking that before taking radiology, you need to think twice. Hello everyone, I'm Dr. Rishabh Jain. I'm a senior resident in the Department of Radiodiagnosis at AIIMS New Delhi. And in this video, I'll discuss what are the top 8 reasons why you should not choose radiology. So let's get started. So I'll tell you a brief about my story. So in July 2018, I joined PG in radiology. And in all the entrance tests in AIIMS as well as PGI, I got very good ranks. So I was rank 4 in AIIMS PG and I was rank 11 in PGI Chandigarh. During my time, there was no INI CT that used to happen. There were separate exams for each of the central institutes. So these were my ranks in the central institutes. I did not give JIPMER, I did not give demands. And during my time, my rank was the highest amongst all the AIIMS students that appeared during my time, as well as people from other AIIMS as well. And my passion during MBBS was surgery. I wanted to be a surgeon. Surgery used to excite me. Surgery used to give me that oomph. I really liked surgery postings and I used to attend surgery minor OTs. But I got a good rank, and suddenly there was this new branch named radiology which suddenly came into picture. Ghoom ghoom ke kahin se aa gayi. I had not thought about it. I had not been to a radiology reporting room. I had not seen how a radiology resident or a radiologist works in life, but suddenly there was a new choice that was available to me, because as they say, radiology आप choose नहीं करते, radiology आपको मिल जाती है. So I was one of the persons who was in that position to take radiology. And if you ask me currently, do I hate my job? Absolutely not. I love being a radiologist. I love every second of it. And there are some periods when I don't really like my job, but overall I am pretty happy about what I am doing. But for anyone who is coming into radiology, he or she should know that, like any other branch, radiology has some drawbacks. And in this video, I would like to share few of the drawbacks that I felt during my residency, and which I don't know whether these will continue throughout my life, but this is what I feel currently. So the number one is fame. So if we assume that this center person is a patient, and all the other people that are taking care of the patient, so suppose this is a surgeon, this is an orthopedician, this is a physician, this is an obs-gynae person, this is a pediatrician, etc., etc. So these are the persons who are directly involved in the patient care. And let's say this person is a pathologist who is involved in patient care, but this is someone who is not directly involved in patient care. He's indirectly involved in patient care. And then there are some branches like anatomy, biochem, physiology, which are predominantly involved in physician training. So where does radiology fit? So radiology fit at the junction of clinical and paraclinical subjects. And it is very well suited for those persons who do not directly want fame, but the patient will never know you directly. Even though you contribute to patient care, there are something called multidisciplinary teams, and as being you are an essential part of a multidisciplinary team, and hence you become a part of patient care. But the patient will never know directly what your contribution was in his patient care. Since the clinician is interacting with him directly, the clinician gets to have the fame, the clinician gets to have the respect, and the clinician gets to have the wah-wah of the patient. So if you are someone who wants fame, who wants to be known in the society, so radiology will not let you have that fame instantly. Like that is for, let's say, an MD Medicine person or a cardiologist or for a surgeon. However, if you take intervention radiology, so intervention radiology again fits in this closely knit circle, because you are directly involved in patient care. So for example, if a patient with hepatocellular carcinoma comes, which is unresectable, so the predominant treatment is done by intervention radiology in form of something called as stare, and it is a radiologist who does that. But then intervention radiology is not the typical radiology that you are used to seeing. Intervention radiologists are predominantly clinicians. They also take care of patients. They also follow them up. So the classical radiology that we know does not give you as much fame as the clinician gets. So the second point is encroachment by clinicians. So since imaging is now being widely used in patient care, a lot of each specialty now knows its relevant imaging. For example, an obstetrician gynecologist knows how to do an obstetric ultrasound. Medicine emergency people know how to do a POCUS ultrasound. Similarly, you won't get many referrals for reading chest x-rays because now everybody knows what are the relevant things that they need to find in a chest x-ray. Similarly, even pulmonologists now know how to read a HRCT. Orthopedicians read their own extremity CTs, and neurosurgeons read their own head CTs and spine CTs. So this is something that has been happening over the past decade, and radiologists themselves have been teaching clinicians in the form of radio conferences, in the form of clinical radiological rounds. And so basic radiology of each specialty is being taught in respective MDs now. But that does not mean that these specialties don't need radio referrals. Radiology still forms an integral part of it. They need it for confirming their findings, for discussing differential diagnosis, to differentiate some findings from, let's say, artifacts, and to perform dedicated imaging when there is an equivocal findings. So the third point is I would like to discuss is distant from patient care. So if you are someone who want to be part of the patient care directly, so patient does not thank you if you are a radiologist directly. But then the thing is that patient also does not beat you. So if you are someone so it's up to you what you decide, what you want during your practice. If you are someone who likes being part of the patient care, who likes that patient should thank him, so radiology probably is not for you. So the fourth point that I want to discuss is about patient management. So after 3 years of your radiology residency, you tend to forget patient management in the form of what treatment is being given and what medicines to prescribe for a particular illness. I mean, if you are active in radio conferences, if you are active in a multidisciplinary team, you would not forget these things. But since you're not directly involved in patient management, you tend to forget these. Also, during your radiology practice, you will come across contrast reactions. For example, if you give iodinated contrast, some people develop allergy and even anaphylactic shock. And in those situations, radiology residents do need help of a clinician. Like the first call that I gave if a person has anaphylactic shock is to a referring medicine person. And especially if you're performing, let's say, ultrasound guided biopsy or ultrasound guided pigtail drainage, and supposedly you burst an artery. So you would need an emergency clinical care and clinical referral. Similarly, if you're performing, let's say, endovascular coiling and suddenly that aneurysm bursts, you would need a neurosurgeon to take care of or a neuroanesthesia to take care of the raised ICP. And also, if, for example, your parents or your family fall sick, you do not remember so much of a clinical practice, clinical management after 3 years of your MD radiology to directly tell them the treatment. You would need a referral of a clinician. So number five is that radiology is a dependent branch. You are dependent on your clinician for referrals, for admissions in case you are doing an intervention procedure, and for post-intervention management. For example, if I do a thrombectomy for a stroke and the patient needs an ICU care, so I would require a neuroanesthesia or a neurology resident or a clinician to take care of my patient post-op. So number 6, it's a capital intensive branch. So I've kept this at the 6th position and not at the top because it is overinflated to the medical graduates. And today I want to discuss approximately how much is the money equation that is required for setting up a radiology practice. So let's assume your basic radiology setup involves ultrasound, X-ray and CT scan. So basic ultrasound, which will do everything, which will do your obs ultrasound, your pediatric ultrasound, your echo, your MSK ultrasound, will cost around 13 to 14 lakhs. And the range is very wide if you compare ultrasounds. They range from 3, 4, 5 lakhs to even 1.5 crores, 2 CR. So, but a basic ultrasound that will do everything for you will cost around 13 to 14 lakhs. and the cost will rise obviously if you add something called shear wave elastography. It's just a fancy technique which is now used for quantifying liver fibrosis. Obviously, it's used for a lot of other things, but this is predominantly its main use. So again, so now for a basic X-ray setup, if you have a CR system, the basic price will be around 4.5 lakhs. So till now I've rounded off to around 20 lakhs. So now cross-sectional imaging is something which is really expensive, and if you want to have a CT scan in your setup, initial 32 slice CT, which will do everything, even your cardiac CTs, will cost you around it's a new CT scan, it will come in the range of around 1 to 1.1 CR. And if you take a refurbished to a CT, which a lot of people do, and it costs around 70 to 80 lakhs. So till now, the basic total setup that is required for a full-fledged radiology practice, I would say, is around 1.3 CR. So, and it's not that much that you cannot afford. So I'll tell you so what is the equation behind this. So what people usually do, that they do a 70 to 80 lakh down payment, and the rest they take around 50 lakh or 40 lakhs loan. Now the main cost which increases your cost of setup exponentially is basically MR, which is really, really expensive. Even if you take a second hand MR, it costs around 2 to 2.5 CR. And then there is additional cost of wiring, earthing, printer and generators. So what is the basic salary of an MD radiologist post 3 years of MD and 1 year of SR, I'm saying? So in South Delhi, since it's a premier location, everything is about just location, right? So in South Delhi, there are a lot of hospitals, a lot of diagnostic centers. It's really the hub of medical care in Delhi. So post-MD doctor will typically get around 2L per month, and but it ranges if you move. It increases if you move to a lesser posh area, let's say East Delhi, where it will go till 4 lakhs per month, and if you go towards second tier city, you will get a very good salary, let's say till about 4 lakhs per month, and in Dehradun, since it's a capital city, around 3 to 3.5 lakhs per month. And so let's say you are practicing in East Delhi, and after initial residency year, you can do some hustle and go to a periphery place, and let's suppose go to East Delhi, and you, out of your salary, you save around 3.5L per month. So in 2 years, you will be able to save around 80 lakhs, right? And with that money, you can initially pump up into your investment, into your setup, and take the rest money as loan and like open your own thing. So it's not like it's impossible. Obviously, it's very tough. Everybody is different. Everybody's financial situation is different, and it is a very personalized choice what you want to do later in your life. But that is not such a big determinant, in my opinion, to not take up radiology, as it is inflated. So my next point comes that it becomes a little monotonous. So I know a few of my male colleagues or even seniors who get bored now after reporting a whole day, and so everybody, the radiologists that I know, either has a hobby which like keeps them engaged and which keeps them motivated. But females absolutely love it. Like, they have enough time with the family, they can spend time with their kids, and it's really good money. So females absolutely love it. So the next point I want to discuss is a little late recognition. So your fame depends on how good your report is. And being a radiologist, your patients are doctors, your clients are doctors. So, and doctors are pretty tough to impress. It's a tough crowd. So recognition as a radiologist comes a little late as compared to other branches where the client is a direct patient. And so this also bothers some people. In this list, I have not discussed AI because it warrants a whole discussion on itself. And when I was joining MD radiology, AI was everywhere. Like, it was such a big thing during my time when I was joining, but suddenly I see now nobody is talking about AI. So don't be scared of it. It comes and goes. ये discussion होता रहता है AI वगैरह का, and we'll discuss about it in some other videos. And so this was my list of top 8 reasons why you should think twice about choosing radiology. And good luck. You can contact me on Twitter if you have any queries. Thank you.